Today we're going to talk about the cervicogenic headache, which cervico means is the cervical, hemicrania is the cranium, is the head related problem called as a normally we do have a frontal headache, temporal headache, parietal headache, occipital headache, cervical headache. But normally the topic is cervicogenic headache. So that indicating today people are really bothering from the children to the geriatric level, the palliative care level, the people wanted to spend the time. During that particular time, we have only one friend that's called as a phone. So through that phone, the people are engaging. Lot of shots are coming to understand and to spend our time lavishly. And of course, sometimes it gives the immense knowledge as well. By the way, doing the same procedure without any kind of the intention, wanted to get some kind of the time pass, that really bothering to the all the people across the globe. And today if you go to the bus stop or the railway station or the airport, on the ancient time around 10, 15, 20 years ago, the people engage and talk each other and introduce each other. Today no one is really wanted to talk to the other person, so much they engaged in the bus or the anywhere in the world. So that situation, the phone is the friend or the girlfriend to the boy, and then for the boy is the girlfriend to them. In that situation the people are engaged. Due to that reason, one mistake it happened to everyone, so including me, and almighty should save god to everyone. So normally what might see, you look at about the my chair is like this. If I'm sitting, this is the right posture, whether I'm sitting like this also right posture. I'm just spine is erect, my neck is erect, my scalp is erect region. So at the same time, when they are looking the television, by the way, I don't have the phone here. So when they wanted to see the phone, always they engage and scroll something like that. So this is the posture is like this. They are watching the phone. You remember when the neck is bending the forward direction, even all the corporate level, because they wanted to do their job is to work for minimum 10 to 12 hours per day. In that situation, timely it gets the forward direction. Due to that reason, definitely that have the impact on the cervical region. You imagine today may not be possible. Maybe 1 year you don't have the problem. The children for the 5 to 10 years they don't have any problem. Maybe perhaps 5 years they have the practice putting the forward direction and they are reading and then writing. They don't have the problem. Later period definitely have the impact. You remember, maybe I don't have any problem. This is my way of practice. The people are thinking. Then imagine, and then cervical totally 7 bones are there which is connected to the brain, and also connecting the 8 nerves are connected to the cervical region. So those cervical region is getting the impact. You remember that is nearly 30 to 40 kg of the weight you are putting on your neck region. You says that I don't have any problem, I never felt any pain, but today may not be possible, but down the line definitely have that great impact to the people. Slowly will develop the cervical pain that's called as a cervicogenic pain. So slowly that develops as a C4 is the culprit. C4, C5, C6, C7. You look at about the X-ray or MRI, greater than maximum 50% of the world population will have this kind of the problem, or maybe slowly develop this problem. So due to that reason, the first bone to be known as a cervical bone, that is atlas bone, where the entire head of the 2 kgs of the weight is capturing on the atlas bone. When you are putting forward, there is only one base that's called as a atlas. The second bone is the axis. But the what burden, how much that need to take? The brain itself is 1268 grams is there normally for the adulteration. So then adult head, then entire the scalp, scalene muscles, upper trapezius muscles will get strained. Due to that reason, that get the stiffness, spasticity is the reason to cause the hemicrania, is the reason to cause the occipital headache. Once this will happen, remember the occipital nerve, smaller, greater occipital nerve, lesser occipital nerve, which is governing to the retina, the macula, and aqueous humor, vitreous humor, the cornea, the retina, the sclera, all are controlled and regulated by the from which place? from the occipital region. If the occipital region get impacted, remember the facial region also get impacted. Today people cannot study, children cannot see the board. You could, that all this will be the reason. Maybe children sometimes they don't use the phone, but still they do have the problem because of the wrong postures as well. So normally what is required is you need to be erect, sit properly, and then your spine should be erect. Then now somebody, you are sitting here, now I am talking to this direction, this is my wrong direction. You are sitting here, I am talking to you, this is the wrong direction. But now you people are sitting, just my focus is on you, that is the right posture. If this posture should maintain, maybe may not be possible, but this is my habit. So my staff is sitting there, the lawyers and judges, they sit like this and then they will guide them. You just do it. They are talking and they are telling and he is doing the typing. But all the advocates having this kind of the problem, the postures having the issues as well, could be the reason to cause this pain. So due to that reason, remember, when wanted to treatment is the secondary part. Before that, what are the etiology and pathogenesis, root of the reason to cause this problem, we need to analyze, need to do the prevention there itself is required, number one. Number two, later period, try to correct your postures and further you just take the treatment. No sir, I take the Panchakarma treatment or Ayurveda or acupuncture, acupressure, any kind of the treatment. Once you complete it, again you are doing the same job, again that causes the problem further after some period of time. Today perhaps you can manage by doing the cupping therapy or acupressure, acupuncture, later period. So once you've done this treatment, later you will be all right, obviously. Then again you are doing the same mistake, and tomorrow eventually will going to happen. Do the MRI scan, the disc got the compression. Due to disc got the compression, the cervical now is called as it gets the compression. Maybe it is the radial now, medial now, musculocutaneous now, phrenic now, ulnar now get damaged. Due to that reason, the numbness in the hands, but perhaps you cannot sleep on the one direction. That's time it's required to do the surgery. The surgery also not all the time it is applicable to everyone. It's not the cup of the tea to the people to go and take the surgery easily. But that to have some complication, and sometimes you have again relapse chances are there. Why you wanted to proceed to that level? In that severity, obviously there is a intervertebral disc related disease. That time perhaps sometimes it is required the surgery, but all the time may not be required. People are suffering that. Try to give this awareness to the all the people how to retain this in the normal postures, to refrain to get these problems. Normally it is good to maintain the postures as well. Along with that, wanted to get into the treatment, but normally it is advisable to do as a pressure points. It works like a miracle and a wonderful relief you will going to get. So where we need to give the pressure, normally I told you cervicogenic headache. So that headache can be controlled if the person can continuously do the pressure points on the, I'll tell you the names, that's called as a Tiansu UB10, and then is the Feng, this is the gallbladder 20, and then further is the gallbladder 12 Towangu. Then again it is the Anmian 1 and 2, that is a sleeping point as well. You activate these points exactly on the posterior side. So this is your occipital region. So this is the bones of the occipital. Yeah, once you come down, press this and then come down and then give the pressure to occipital region. So once this is the bone, after the bone you come down, you will get the depression. In this depression you just activate, give the pressure 1 2 3 4 5, 1 2 3 4 5, 1 2 3 4 5, 1 2 3 4 5. So bilaterally you keep giving for 3 minutes and then shake your head right and left region and then go backward and forward direction. Definitely you feel lot of relaxation. Wow, amazing. I feel some kind of the relief, that indicating the nerves which is connected to that occipital nerve that going to release, and also which are the muscles connected to that. As I told you, those muscles get the dilatation on that region and you will get really relaxation. By the way, there are the certain nerves, as I told you, the vagus nerve which is going to the cardiac system. The heart and lungs can be controlled by activating some of the points in this region. Therefore the person will get the hypertension, that also gets controlled.